channel Travel with Ironwar. Today I have special guest from Ireland. I will be introducing her, but before going to the detail of the video, if you are new to my channel, kindly subscribe my channel and click on the bell icon so you can receive my videos and videos about the jobs, about travel, about any kind of a visit that you want to go abroad, or for the tourism, for anything. So my channel will be giving you the right pathway and giving you the correct information about all the visa process. So today I will be discussing with my guest. So first of all, can you please introduce yourself to our audience?
Yes. First of all, thank you so much, Tahir Bhai, for calling me on your channel. And I'm very happy to answer your all questions and answers. And my name is Nadia Seher, and I belong to the same nursing community. I left Kuwait just now before 8 months. So I'm love to happy for the Pakistani nurses, especially. We will help all the nurses, but I just took this initiative because I can help my colleagues who are not happy in some place, or who just like every time they want to fetch for some kind of enhancement of their career. So
Okay,
we have
so can you
so many
please
things.
tell
Yeah.
me about your city where you are currently living, and how is the weather there?
Yes, I'm living in this town. It's just a county of Dublin, and Dublin is the capital of Ireland. And at the moment, weather is not good actually. It's freezing right now, but it's just normal for Irish and Ireland people because it's not getting more snow here, so it's normal to go on their duties and doing their jobs. So that's fine. Yeah.
Okay, so it means it's outside totally freezing. So how do you people
Yeah, it's freezing.
arrange to go outside? And it will be definitely difficult to go on the job or to the
Actually, what
any
I can
area
say.
with this severe climate change.
Actually, people have their jobs. They try to live around the hospitals or wherever they do the jobs. Otherwise, they have their cars there. And it's just like you can say it's little bit more than Pakistan now. Whatever we have the weather in Pakistan, it is freezing at night actually. So it's just
Okay.
little bit snow here, and we are surviving like this with the clothes and all that. We have to wear good clothes outside.
That's really good. So, okay, let's come to the topic. So, you have started your process for the Ireland, and what make you to go abroad? So, what was attracting you there? So, can you please start speaking about it?
Yes, thank you for asking me. Actually, my initiative I took is that because I have three daughters, so I just want to take my family to a safer place. It's not just like that. We are not living in safer place, but it was my dream to give, being a Pakistani, and we know all we like to move to that countries who give us the nationalities, and they give the actual equal rights to our families and children, and they are giving the benefits as well. So I heard about my Ireland from my colleagues, and they told
Mm,
me that Ireland is a
okay.
very good country. The children are they can have education free here, and
Mm.
even though I'm a nurse, after my PR, I can pursue my higher education. So these are all the things which just attract me. So I should be here, and I heard that the salaries are very good. They are just calculating all of your experience. So
Okay.
being an experienced nurse, we like that our experience should
I'm
be
not going
included.
to,
Yes.
ask you about the salary right now. So, can you please tell me how you started your process, and what thing exactly inspired you to move there? Like, for example, you were also getting the good opportunity here, but what was the exact reason that pursue you? The first thing you told me about
Yes.
your
Thanks.
education. The second, good salary. The third,
Yeah,
your
yes.
children
And
education was. Do you have any internet connection problem? Can you hear me out?
yes, I think currently it's causing some problem. Anyway, the things are like that. I start already told in my videos as well that to come to have to do our language programs first.
Mm.
So they just require OET or IELTS, and for IELTS they need like three bands, any one of the modules. So we have four modules: reading, listening, speaking, and writing. So
Okay.
any of one module you can take either 6.5, or in OET you have to do C plus. But other all modules in IELTS you have to take seven bands in three
Okay. And
modules,
you need to
and in OET B bands. Yeah,
all be except writing.
yes, all B.
Okay.
So what
So
attracted me is that yes,
what is the exact
I would.
Irish people? Are they totally communicating with the hospital staff in Irish language, or it's okay? They can communicate with you in English.
Actually, they are very good, and they will take you as a family. So they just communicate in English, and it doesn't matter. Like, you have to have a very good English. You just need to communicate with them. So they speak. All of them speak English, and they have their own Irish language. But most of the people don't know that, like the new generation. So they are also trying to teach as well that language, but they are communicating in English
Okay,
actually.
before wasting more delays and coming to the point, how you started your paperwork. So, what was the first point you start with your paperwork? So,
So
what are the
when
documents required for the Ireland visa, and how long this all process took?
Actually, this process doesn't takes more time, because I don't know this. I was doing it my first time, so it just takes 3 months to do all this process actually. So this process is divided into two steps, as I told before. This For the one process we have to take DL, and then for the other process we have to reach out the other companies or agencies who hire
Hmm.
us. So how I did my process is that when I got my OET, I contacted to some of the colleagues which refer me to an agency. They are taking Indian money, 15,000 actually. So
Okay.
50, just 15,000. So it is Pakistani 50,000 rupees. So that's just all cost me. But what I tried to do in my videos, that I just went onto the NMBI website. NMB is a nursing registry midwifery board of Ireland. So
Okay.
I posted a video there. That's how you can upload your own documents. There is no need to give anybody any kind of money.
Hmm.
And like he told me to do all the process first, and then after that they wanted a good standing certificate. So
Okay.
I always recommend everybody that you need to have a good standing certificate first, and then just go ahead for your documents. And for the
Nadia,
documents,
thank
like,
you for such a crucial
yes,
information that you have already delivered. And
yes,
most
yes,
of the people, they still have some ambiguity, and they are still confused that from where
yes,
we have to start. So the first thing that you told us, that first you need to score your desired band in English language, and the
yes,
secondly we
yes,
will
of
go to
course.
the NMB website where we can initiate our process of registration. And
Yes, and
this
that's just very easy to
registration
do
process,
actually.
how much
Yes.
they will ask to pay for the registration to
So
get the
they will give
license?
you, yes. So make sure your documents should be valid within 6 months. Don't let them expire, because they are going to be signed with your school of nursing, with your principal of nursing, and from your current employers. So make sure they should be in date with of 6 months, and they will give you 6 months to upload if there is any kind of lacking. But I recommend you make a copy of all your documents, put it in the file, and then you just go ahead and upload them, and they will charge you 380 euros, which are mentioned on their website. Once they will charge you, they will give you 6 months, and they will repeatedly sending you the mails whatever will be the lacking there. But I recommend you that, please, I have made a video, prepare your all documents, put it in the file, and just make it upload. And yeah, and then they have written on their
Yeah, can you
website that
please
if,
mention your channel name? So
yes,
most of the
it's,
viewers, they will ask me about your channel name, and we will also
so
mention your channel name in our description, so they can get more information by searching and reaching you. And if they have some questions, they can also put down in the comments.
yes, thank you so
Thank
much.
you.
So I
Just wait
named
a
my,
second. Some of our friends, they are asking about the how much money for Ireland visa. So these questions will be addressed Just let me complete the first session of questionnaire, so then we can go
Yes, we
further
will do
asking
that. Yeah.
questions. Yeah.
Yeah, we'll do that. So, like, I just recommend you, like, just prepare all the documents and get it ready. And my channel name is Pakistani Nurses. So I named it because I just want to really, I want to help from my heart. I don't want to waste any of the colleague money, because how we came to Kuwait given us
Yes.
respectful job, and I wanted to do the same thing what is our agencies are doing overseas is doing. So we spend nothing there. And even though I just want to recommend you that Ireland is giving back all the money, so I didn't spend more money. And my channel name is Pakistani Nurses in Ireland. Though I found so many videos of our doctors, Pakistani doctors, so there are lots of doctors in my hospital, but I'm the one Pakistani nurse in my
Okay.
hospital, so that's why I
So
named my channel. Yeah.
okay, so going to the next question, you did not mention the further what when once you have submitted your documents for NMBI, that was from the schools and from your different hospital experience certificates. After that, what they are gonna ask for the visa process, and will they ask for any OSCE sessions? Is there any stations for the examination of skills, or what is the other option for that?
Yes. So when our first step will complete, you will get the DL within 21 days. So they mention on the website you have to take a DL, means decision letter. Once you will get that, we will start searching for the job. So it's upon you. We have two options to come to Ireland. One is that we have to take an admission in RCSI, that is a college of Ireland. We have to take admission there, and we have to give same OSCE. It's called aptitude test. So we have to pay for it 2,800 euros, which will be refunded by the agencies. And like I chose adaptation. That is more good. What was convenient for me, like we have to work under a mentor for 6 weeks. So it can extend up to 12 weeks, but it depends only totally upon your performance. If you perform very well, they will finish it on in the 6 weeks. Yeah. So I
Okay, in
prefer
this
about
six
OSCE.
weeks of period that you call it adaptation period, so in this 6 weeks period, that what kind of things you're gonna experience, especially in clinical sites? So can you please mention these all things?
So it was before, like when I started, it was very tough. But what they will do for 1 week, they will refresh your all of the non-nursing knowledge. They give
Okay.
you the classes, they give you to do the certificates, what you have to
Okay.
repeat, and they just refresh everything what we have studied. So they make
Okay.
sure that we don't make any kind of mistake. And after that, they send us. They do the induction, and then they send us according to our experience to the wards. So they
Okay.
give their one person or two persons, that is called a preceptor. So
Hmm.
preceptor always teach us, and for the 6 weeks they will train you. They will. We just need to know the routine of the ward, and especially what we are doing there. We are using the Omni cells for the medications in Kuwait, but here in Ireland, the medication trolleys are there. We have to look at the generic names. We have to make sure, and even if you don't know, they will refresh all of the things. Even you cannot pass the cannula without a certificate. Yeah. So it was a good experience for me, but we get like stressed. Yeah.
So you want to say that you have already passed second time your cannulation certifications, and plus
Yes.
your ACLS, BLS, and whatever the certification was remaining.
Yes.
So you refresh your
Whatever the
knowledge, or
certification.
that's okay if it's valid.
Yes, that's okay. Like we have to do this, and it's valid for 2 years. And even though I know some of like sisters, they don't like to push the trolleys and all the things, the beds for the patient like procedures. So here they just take care of us. They give us a manual handling training. So we are not supposed to push the trolleys. We are not supposed to push any kind of wheelchair, and we are not supposed to take the patient for any kind of procedure. So the situation of work is very kind here. Everybody's kind, and you have to do your nurse jobs. And there are healthcare assistants, there are other people to help, and there are attendants who are taking the patients for the procedures as well. So that was one one thing for, especially for the girls, I think.
That's
They can
surprising. These
understand what I
people,
am telling.
they will watch this video later on, and they will come to know that this is the big advantage if you go
Yes.
Ireland or any of the Western country to
You don't
practice
need to
your medical.
push or pull
So
any
you
bed
will
or
not need
any
any
stitches.
extra burden on your head. I
Yes,
think this
you
is
have
the
to do your
amazing thing, you
nursing.
know.
Yes, it's a magic thing. And one more thing, why I choose adaptation, it was because they were paying us, and they pay after 2 weeks like 500 euros, and that is much enough. I think like we have to save, and these 3 months we can like save, and we can pay our rent, we can do our things, and the agency is paying for everything. Like you don't have to make you don't have to worry about big things actually.
Can you
So
please
like
tell me how is the social life in Ireland?
it's very good.
Do you
I
have
found it good.
social
What I heard about the Western
social
countries.
gatherings, or you go with friends or colleagues
Yes.
or family, or
Oh,
you
they
will?
like to chat. Actually, I don't have more colleagues here. I have hospital colleagues, but like we are very busy with all families and all that. So I'm the one not with the family. So the environment is very good. What I thought about the Western countries, what we have heard, like I just found it alternative. So the environment is very good. It's a small town where I live here. It's just near to the capital, but we have all the things here. So they are very possessive about our their same living, what culture we are living with our parents, with our grandparents, and the school system and clothing, especially like we care about this. We Pakistanis care about this. Girls and our children should be covered. So yeah, you are free to do everything here, and they're
Okay.
very humanitarian and very lovely people.
Let's talk about the duty roster. Is this hectic, or you can manage it? Like how many days
Yeah,
or how many
actually,
days in a week you have to go for the work, and how many hours are there?
so the good news is that we can work just 3 days. We are working just 3 days in a week. So we have 4 days to do anything. And you can work with another an agency as well, but not now after 2 years. And the thing is that it's very good. We are working for 12 hours, but after that, we can give lots of time to our families. Sorry. And one thing I would like to mention, as mothers, we want to always stay at home with our kids. So it's very good for us. And one thing is more, we have maternity leaves of 6 months here. And after that, if your child is small and you have to stay at home, so you take 9 months parental leave as well. So that's very good to grow up a child, and they care for your children. And there is a school fund as well. I think they are giving to the children. So they give 140 euros to each child for the studies, and studies are absolutely free. So as being a parent, you don't need to think about their things, to think about their books, and to think about their all the needs. Yes. So
What did you
that's very good.
mention? I believe that it's incredibly great news for those, especially the females, that if they have some medical issues
Yes.
or they got pregnant, so it's 6 months leaves are
Yes,
enough.
it's 6 months
So
leaves
you
here.
can
Yes.
spend your time with the family, and these leaves are paid or unpaid.
Yeah, these leaves are paid actually, and it's very good for the children and the child and the mother. You can brought him up to 6 months, and then you can go on your duties. So that's a very good. I love it about. I love all these things about Ireland. Like you have to stay with your child, and the thing is that like if you are working for 3 days, and even if you are sick as well, so you have 28 days leave in a year. And even like these 20 days, if you consume to if you work 2 days, and the other one day you take a sick leave, so you have 28 sick leaves in a year. How you consume it depends upon you. Like if you are really sick, you can take that, but I think we are comfortable to work in 3 days in a week.
In in
Yes.
my second question, I will be asking you about the income per annum and per month. But before that, can you please mention all the living expenses, and including your like where you are living in flat or in any accommodation, food, and other expenses like transportation, and how far
So
is your hospital from your accommodation? How long it take you to reach there? Do you take any bus or any kind of a transport service?
yes. So the thing is that the one problem is here in Ireland, that the accommodation is very expensive. So, but when you start getting the salary and you start living with your family, it doesn't get more. So it's same like Kuwait, what we are living with the family. They doesn't support for any kind of hostels. If you are single, so you have to take a room. I have taken a room, and it's just like I can afford with my salary. So yes, and
Like
the
a single
things are
bedroom
you.
apartment, how long it will cost?
It's gonna cost you like 600 to 800 euros, but it just depends upon the area, and it depends upon your landlord as well. So that one thing, people are afraid to come here because just for the accommodation. But we find that it was not a big issue. The companies are referring, and everybody here can accommodate you if you have money, like you if you can pay.
Hmm.
But it depends upon you, like from 600, or it can go cheaper as well, 550 as well. So it totally depends upon the landlord. And I'm just living nearby the hospital, so I don't have to take any kind of transport. It's very convenient for me. It's just 10 minutes from here, my hospital. So I chose this. I'm paying little high rent at the moment, but that's fine for me because I don't, in this cold weather, I don't have to go anywhere. So it's just 5 minutes, I can come back, and it
Yeah.
gets dark like late
And
earlier.
can you please mention other expenses like your groceries and other foods for the three persons?
So groceries are like it's again depend upon you. If you want to eat an expensive things, or if you want to
Because
go in
so many people
expensive,
they ask me
yes.
about the inflation rate in Ireland. So inflation
Actually, the
rate is
taxes
high
are
or
very
low?
high. If yes, you have to pay a tax from your salary. So if
Hmm.
you are living single, you have to pay 40 percentage of tax. And
Hmm.
if you are like living with your family, then they will reduce the tax. They know you're living with the family, so you have to pay 25% of tax. So in that 20 or 40 percentage, you have a
What
pension
services they
there.
offer? Just also mention these all services.
Yeah. So
If
when
they
you will
deduct
be
25% of your total salary, so what services they gonna offer you? Like
so
your
medical is. Yeah, for in that services, medical is free, and lots of thing. There is a government ID here, so there is a social work government ID here. So some of the things you will get for free, and as per the yes, I forgot to mention the transport. So we make a leap card here, and we have to submit some money in that card. So it gets like very cheap. You have to pay once. Just in a day, if you want to travel all of the country, you just have to pay 8 euros, and you can go up to any bus, any train, and that's absolutely free. And it depends upon your like what your requirements to spend. So it just
Sorry for
totally depends. Some
interruption.
things
One
come
of our
cheaper.
viewer,
Yeah.
Asif Deshwal, he has mentioned in his comments that can you please help me? So what kind of help you need? Just put down the comment. Just write your message so we can easily read it. Okay, continue.
Yes, you can. Yeah, you can put your query down, so we will answer. So the thing is that some things are very cheap, like vegetables, and some things when we go to the Asian shops. So the problem is that they have to pay the tax and they have to bring the things here. So I'm living in a small town. It's not too much big, but we have here Asian shops. So whatever we need, the Pakistani masala, everything, it's available there. Halal
Asian.
food is there. Yes, halal
There
food.
is so
Asian
many
shops
things
are
for the
there.
Asian lovers. You can
Yes,
mention this
there are
because
there are
so
vegetables.
many viewers
Everything we
from
can get
India,
here.
from Bangladesh, from Sri Lanka,
Yes, from
all over the
Bangladesh,
world,
from
they are
India.
just they
Yes,
are having the eyes on our channel. So they really want. They are desperate to know about the every single information that from starting till the end, starting from the visa process and till the end, how to get the sponsorship job there. So we will be mentioning all the uh, agencies that work and they hire you for the job in the Ireland in hospitals. So also we will
yes,
just check you our description. We will be mentioning all the names of the agencies. So can you
yes. We'll
please
do
now
that.
tell me about the yeah salaries? How the nurses they get the salaries and what is uh,
So,
if you if just exclude the taxes and what will be the total income for the month?
So it's very good. It depends upon your experience. If it will start from 2 years, so for every year they put €100. So there is an organization that is called INMO. That is a special organization for nurses, and INMO is taking care for the salaries, and they always are with us to fight for the salaries. I can say it. I should not say it, but they always have a keen look on that, that the nurses should be paid a very nice salary, because we are working for more for the patients. So INMO has a chart. They have a website as well, INMO. So they have a chart there. You can go there, and you, according to your experience, you can see what will be your salary.
For
So as
example,
per,
I have
for
15
example,
years of
yes.
experience. So, what will be the experience advantage for my this all, including my salary?
So they
So,
will
how much they will
they
pay
will
for my experience per annum,
Yes, so you
like
can
per year?
calculate. Yeah, yes, so you can calculate how is that they are, the basic salary is same like England. It's 32 to 31. So, but when you will include your experience in that, they will, you can plus that. So how much experience you have, you're gonna have that salary. Like I think you will have near to 50,000 per annum, or near to 48 to 49,000 per annum. And even though after 2 years, the good news is that what I like most about Ireland, you can switch your role. We have diabetic nurses here who works in hospital as just a diabetic nurse. We have a wound care nurse. We have infection control nurse. So if you have these kind of certificates, or you will do here in RCSI, that aptitude college, it gives this facility as well. So when you, after 2 years, you will get your PR, you can study for free, or just you can pay a minute amount to get career enhancement. And after that, you can switch your role and you can work anywhere. You are not bound to work with the agencies, or any hospital or HEC as well. So you can work in another area. If you want to switch your role, you don't want, if you want to know, like somebody have an aim to open a shop, or somebody have an aim to be another thing, you can work as well. That
So,
you can
this
do.
is the great opportunity for those people if they migrate there, so they can also open their business, and they can switch their.
Yes, you can do
So,
that.
will there be any requirement for that, or they will be existing with the same visa?
The visa will change. Actually, we have 2 years of contract, and after that you can switch the role. If you want to continue, it's totally upon you, but they're not gonna send you back. You can switch the role, and if you go to another agency, they will convert the visa. But after five years, they will change your passport, and you will be an Irish. So you don't need any kind of contract, any kind of passport, any kind of thing like contract. So you're not bound
One
to
of the
anything. You
viewer,
can
he
do
has
your own
mentioned
thing.
that how long it will take to get the PR in Ireland.
Yeah, it takes 5 years. It takes 5 years, but after 2 years, you get stamp four, and you are eligible for all the free studies. You are eligible for more, like most of the things.
You can
So
claim all the benefits of Irish people. In short, you can say
you can
that.
do that. Yes, I can do. I can say that after, and it's for the critical care visa. News is that for other people, it takes some more time. But for the critical care visa persons, you can bring your family after 45 days, and you can you're gonna change your stamp one to stamp four in 18 months.
In our chain of friends, there is very big circle of the pharmacist, especially physiotherapist and pulmonologist and
Yes,
other
same process. Yeah.
respectologists, and they
Mhm.
if they want to continue, they will come under the shortage of occupation list, or there is another visa for them.
Actually, you have to go the immigration website, and they have mentioned there what are the critical skills they need. But I think they are also inside that. So just if you will go to the immigration website, and there they have written the critical care visas. So there is a major list there, and they have divided it into the categories, category A and B. So you can have a look, and you can have a look at your name. If you are under that category, you can, yes, you can apply like same
Yeah,
like
could you
that.
please tell me what are the other targeted jobs available in Ireland right now?
Yes. So if you go to the lower side, you can work in the hotels, and if you go to the higher side, there are accountants. There are lots of things there. And in the lower side, there are electricians. Yeah, and especially what I think they earn more is a barber there. So the barbers are very very
Barbers
expensive
are
here.
are still there is huge demand for the barbers in Ireland.
Yes, yeah. So they
So
earn more, and
if
yes.
any of the uh, demand
Mhm.
job available, they also they will ask for the English requirement, or there is another role for that.
No, they will ask you. They will ask you for the lower jobs. They don't need any kind of English requirements. It just totally depend upon the your
Work
employer.
permits.
But you
Hmm.
have to, yeah, you have to come here first for the
Hmm.
lower jobs. I think what I have heard from the
Hmm.
people, you have to come here on the visit visa, and then you have to search a job, and you can easily convert your visa. They will
Guys,
not
this
tell
is
you
one
to
of
go
the
back.
best opportunity for those people if they are in
Yes.
future they are thinking about going to the or migrating to the Ireland, and if they just want to switch their visa, if they receive barely if they receive the visa for visiting visa only, so they can also look and search for the job there,
Yes.
and on that opportunity they can also transfer or
Yes.
change their
Yes, they can
visa
transfer
to
their visa.
work visa. So I think this is one of the golden
Stamp one.
opportunity
Yeah. Yeah, that's
for
a
those
very good
people.
opportunity. And I have seen people like you are recommending that if you apply with your family, so you get the visa easily there for Ireland. And immigration ratio is very fine. And yeah, that's good to migrate here. I just convince everybody like you should bring your families if you are eligible, if you are good to go to work, and you are a critical skill worker. So I highly recommend Ireland. Yes.
What is the average wages for the labor workers in Ireland?
It can be 2,000 euros. Yes, near to so yeah, 2,000 euros, 2 to 3. Yeah, but it depends upon the again on the employer, like what they want to do,
What type of job
because
and
we
what
are
kind of
getting the
skills he
salary
has?
here. Yes, it depends upon that. You are an accountant, you are a doctor, you are a dentist, you are a hygienist. So yeah, they need lots of doctors and nurses here. So yeah, it depends upon totally upon your salary, your skills.
How the Irish immigration deal with the parents' visa? If you are there and already you working under their health sector, so is it very easy to bring your mother and father?
Yeah, yes, it's very easy. So when you will stay here in Ireland and you will got a PPSN number, so that is a government tax ID number, and like same what we are taking Pataka in Kuwait. So
Hmm.
it's same card like that. We always have that. So once you will get that, you can call your parents. But the thing is that if both of the parents are alive, you can call them for 3 months, and after that they have to go out, and then they can come in again. So they
Hmm.
can stay with you for the 3 months. But if any of your parent is single, and nobody is there to take care, you have to give all of the information to the government immigration office, and then they will allow you, then the parent can stay with you.
So
Yes.
if the single parent can stay with you, but there is some policy or there is some visa requirement for
Yes.
them for the long
Yes,
stay.
there are some policies. Yes, for the long stay. And if your parents can work here, so same, I think the rule is same. Like if they can work here, or they can change their visas for some kind of reason, like the employer can give the visa according to their age, so they can that visa can be converted as well.
Uh, One question was just coming in my mind about the education. If you want to continue your education for the master degree, how much it costs you?
So they don't take anything from outside of Ireland. If you are applying for master's degree, that is very good actually. So you can do the job as well. You can continue your job, and you can do your master's degree. So it costs around like 6,000 euros. But if you live here and after 2 years you are eligible to do that, it just cost you minute, or some of the courses will be absolutely free for you, and it will be from HEC. It's a health department of Ireland, and they will give you this opportunity. So they will send you an email, or you can either apply on the website. If you are a HEC employee, you can do it absolutely free, as well as
One of
masters. What attract me?
one of my friend, he has mentioned that apart from your job, will they allow you extra hours job
Yeah, they allow us.
overtime?
So we, yes, yeah, they allow us. Even though you can get your overtime in hospital, and that's very good. You can work in your hospital, and even if you don't have work in your hospital, if you have a car, so you can go to the other hospitals. There are lots of agencies who are paying hourly per hour. So how much hours you will work, they will pay you. And you can go with the ambulance, you can be an escort. What we are calling here, we're calling escort. So we be an escort, and we take the patient to other hospitals, and they are gonna pay you once the patient will be taken back to the ward.
As you mentioned that be an Scott for the EMS specialist services, will they require any special training for that?
No, they don't require it, because we are fully trained. We can do the IV cannulation as well, because we are the one only allowed for the IV cannulations. So EMS staff is not allowed for the IV cannulation. So they are very happy to take us there. Yeah, even though they are very trained. That's the thing they are not allowed to do.
So what they will do
Yes.
in life-threatening situation if they are not allowed?
Yes, they do. They do
Even
the
they are
CPR
well
actually.
trained.
Yeah, they are very well trained. They have they can do CPR, and unless they can get to the help. Anyway, they are in the ambulance though, so they are very near. They make sure the distance should not be more, so the patient is fine and vitally stable. Then we make sure if he needs oxygen, we send. So that's the reason we escort the patient.
Okay, what the other things you want to mention in today's vlog, especially
So I just want to encourage everybody, and I'm very, very happy to help. I know what
for both
videos
skilled
I
and
make.
unskilled people?
Skilled and unskilled people. So what the thing is that when I came to Ireland, I was very alone. But when I go outside, people are very lovely. You will not feel you are meeting them first time. So it's a very safe environment for my children. So for what I am very happy, they are going to have a very good future. They're going to study here free, and I encourage everybody that I think they will be happy once taking the decision to come to Ireland. Yes.
Very nice to talk to you. And please,
Thank you so
I
much.
want to
Yes.
request my audience, if you still not subscribed, can you please repeat the name of your channel?
So it's
I will
Pakistani
also
nurses in
mention on
Ireland.
my screen
Thank you so much.
Pakistan.
Pakistani nurses in Ireland.
Pakistani Nurses in Ireland subscribe channel
Yes.
for more videos, more information, and we will be
Thank you
bringing more
so much.
information in future for you and for all of our audience. They are looking their future in Ireland. Thank you for joining today our
Thank you so much,
live
Nai Bhai.
session, and this will be a fruitful meeting and fruitful discussion with you about the
Yes,
all the
definitely.
process and all the visa discussion regarding the immigration to Ireland. Thank you very much. And
Thank you
we
so
will be
much.
again coming on our live sessions and bringing more information. If anybody has any question, so kindly just mention in comment box. So we'll be very happy to answer it. Thank you
Yes.
very much.
Thank you so much. Thank you so much for your time. And I'm more than happy to help anybody. They can mention in my, even they can mention in your inbox as well. So whatever the questions are there, whatever the documents they are lacking, they don't understand, they can message me anytime. I'm more than happy to help them. Yes.
Thank you very
Thank you
much.
so
Thank you.
much.
Take care of
Yes.
yourself.
Okay. Yes.
Bye
Allah
bye. Take
Hafiz.
care. Bye.
Okay. Take care. Bye bye.